Tuberculosis is a major cause of sickness and death. It's particularly virulent inside places of detention. Late diagnosis, inadequate treatment, overcrowding, poor ventilation, hygiene and nutrition make prisons an ideal breeding ground for this airborne infectious disease. Over the past 2 decades, a new silent killer has emerged: multi-drug-resistant TB. This deadly disease doesn't respond to 2 or more major TB drugs. Multi-drug-resistant TB, or MDR, is spreading at alarming rates around the world, particularly in much of the former Soviet Union. Despite this trend, in Azerbaijan, the authorities have the best cure rates of MDR TB in detention in the region. This is down to the essential role played by the Special Treatment Institute, a single centralized facility which treats all TB cases in detention. A combination of rigorous testing, scrupulous isolation, and systematic treatment has dramatically improved outcomes for patients detained with TB. Efforts to combat TB, whether multi-drug resistant or not, start as soon as a detainee enters the penal system. All new arrivals at this pre-detention centre in the capital Baku are checked and screened for tuberculosis and other diseases.
This is important because the pre-detention centre is the entry point into the penitentiary system. And all those who've been accused and convicted pass through. What we're trying to do is to prevent the spread of disease in detention and to ensure early detection.
After registration and a medical questionnaire, a number of tests are done, such as chest X-rays and blood analysis. If TB is suspected, a sputum sample is taken and sent to the Special Treatment Institute for testing. The results are known within 24 hours. If positive, the detainee is immediately transferred to the institute.
Birincisi, vərəmi aşkarlamasa öz ətrafı üçün təhlükəli bir vərəm ocağı.
If we don't control TB, this can be dangerous, as everyone around could be infected. The disease can also mutate into a more complicated resistant form, which is more difficult and expensive to treat.
Early TB detection is vital to prevent the spread of the disease amongst a prison population which in many places live in cramped and unsanitary conditions. Once a year, all prisons conduct mass screenings using questionnaires, X-rays and sputum testing to detect cases. Other cases emerge when inmates report symptoms themselves. This radiography van is one of 3 mobile X-ray units provided by the Special Treatment Institute to the country's prisons. The radiologist checks the lungs for signs of TB. At this prison, detainees whose radiography results show they may have TB give further sputum samples. According to the authorities, more than half of the 1,000 inmates are suspected to have the disease, Every year, 30 to 40 detainees are confirmed as TB positive. It's a high prevalence, as the head of the prison's health unit explains.
This is due to the type of regime here. We have many prisoners who are repeat offenders, so that's why the disease cases are relatively high amongst this group.
Repeat offenders are more vulnerable because they enter and re-enter the system, often without completing their treatment on the outside. Testing is done early in the morning, when secretions have built up in the lungs overnight. As they cough, detainees are directly observed to prevent anyone giving a false sample. Living conditions are better at the Special Treatment Institute, and some detainees have been known to cheat the system. Staff keep a distance to protect themselves from infection. They make sure the samples are correctly labelled and secured to avoid contamination before taking them to the Special Treatment Institute for analysis. All roads in TB control lead to the Special Treatment Institute. All TB tests, whether from the pre-detention centres or prisons themselves, are analysed here. And since 1998, the Institute has provided treatment and care for detainees suffering from TB from all over Azerbaijan. On arrival, they undergo a series of medical tests to assess their general health. They are also retested for tuberculosis. More sputum is taken and X-rays done. This confirms the diagnosis and ensures no one has cheated to get into the facility.
We prioritize diagnostic testing, so no one who does this succeeds. To fully confirm the diagnosis, we have many diagnostic instruments, as well as enough highly qualified staff. So if there are such cases, they can be very quickly identified.
Tests are also carried out to check they can tolerate the aggressive drugs used to combat the disease.
Ультразвуковые исследования. Мы проводим сонографию внутренних органов.
We use ultrasound technology to diagnose their internal organs. It helps us to see the state of their liver, kidneys and spleen. And this helps us to understand how the drugs would affect the patient.
As TB and HIV is referred to as the twin disease, new arrivals are offered voluntary HIV/AIDS testing and follow-up care. The institute houses up to 1,000 patients. Healthcare and security must be carefully balanced.
Üçüncü şöbeye geri kalan adamlardan kim kaldırır? Elin kaldırsın. Sen gelirsen. Ümumiyyətcə bizim üçün vacib məsələlər əsasən
Since this is a health facility, the provision of treatment for the prisoners is extremely important.
birinci, ikinci əsas
Security is also important, but the two activities have to be conducted in parallel.
It has an excellent record on treating ordinary TB. According to the authorities, in 2011, it had a 71% cure rate. But for multi-drug-resistant TB, a potential killer, it has an exceptional record. A survey of 200 patients between 2007 and 2009 showed a 75% cure rate, the best in the region and one of the highest in the world for treating MDR in detention. These high cure rates are a result of scrupulous management of all TB treatment and rigorous infection control measures. All patients get individual attention. After 4 days of tests, new arrivals appear before a commission of key medical staff, chaired by the head doctor, which decides on the best treatment for each patient.
I was sweating a lot at night. I had no appetite. I felt sick. I couldn't sleep.
The panel gives him his results and his drug regimen. Everything is done to prevent those with ordinary TB from becoming multi-drug resistant. Every 2 or 3 months, further sputum samples are taken to check that resistance to the drugs isn't developing. The patients are directly observed taking their drugs to ensure they complete the course. If they stop or don't take them continuously, they can become multi-drug resistant.
We were told that we would receive continuous treatment for TB, and that if we didn't continue the treatment, we would face more serious illnesses.
TB patients are often underweight, so they're given a diet rich in protein and vitamins, which gives them extra energy to boost their immune systems. But some patients don't respond to first-line drugs. They're put on a course of second-line MDR TB drugs. Others enter the institute already infected with multi-drug resistant TB. This commission, made up of doctors from the institute and an expert from the health department of the Ministry of Justice, hear MDR TB cases every week. Its aim is to provide the best possible treatment for this complex disease. This patient stopped his TB treatment after he was released from a previous stint in prison, as he'd begun to feel better. But now he has MDR TB and will have to take about 20 drugs a day, including those for side effects, for at least 2 years.
My lungs give me a lot of pain. I hope, and I'm sure, that when I begin to take the drugs, the pain will go away.
Patients with HIV or hepatitis C have to take even more drugs. MDR treatment is highly aggressive, and the drugs can cause jaundice, renal failure, visual impairment and deafness. The patients are offered drugs to help with the unpleasant side effects.
There are initial side effects, such as nausea and vomiting. It's difficult for them to take all the drugs at once, so we administer them gradually to make it easier for the patients to tolerate them.
It can cost around $12,000 to treat an MDR patient. The pharmacy stocks a wide range of second-line drugs and drugs dealing with the side effects. Funding from the Global Fund Against TB, HIV and Malaria ensures an uninterrupted supply. A well-equipped laboratory, staffed by highly trained clinicians, is essential in combating MDR TB. Here, they grow bacterial cultures to detect cases, as well as carry out drug susceptibility tests for multi-drug resistant strains. State-of-the-art equipment allows for accelerated diagnosis for those patients who need to begin treatment fast.
Bunların arasından gen ekspert sistemi 2 saat ərzində
We have the GenX system, which helps us identify the microbacteria in TB within 2 hours and its resistance to a key anti-TB drug. This means that we can start timely treatment for patients who need second-line drugs.
But some patients refuse to start MDR treatment or default because they can't tolerate the side effects.
In both cases, we have awareness-raising talks with the patients. We give them educational brochures and booklets. We repeatedly educate them about the problem.
Counsellors are on hand to support the patients and try to persuade them to keep taking their MDR TB drugs.
I try to explain to them that they have a place in society and that they are needed by their families, and that if they don't complete their treatment, they put at risk not only themselves, but also anyone they come in contact with.
This patient found the side effects deeply unpleasant and wanted to stop, but was persuaded to continue by the counsellor.
I know that stopping can have serious consequences. They explained to me I could become extensively drug resistant. As this has really heavy consequences, I know that I have no option but to take the medication.
There's no specific treatment for patients who are extensively drug resistant, apart from varying the second-line drug regimen.
Their chances of survival depend on their sensitivity or resistance to certain drugs. For example, the 6 XDR cases we have here who want to continue treatment are now going through a change of treatment, which means they could still be cured.
Some patients, even though they're highly likely to die, refuse treatment and are given palliative care. As well as the successful management of TB and MDR TB treatment, the Institute has rigorous infection control measures. Good ventilation systems reduce the risk of transmission indoors. All clinical waste is disposed of and incinerated in a separate area. And most importantly, patients are segregated according to whether they have ordinary tuberculosis, multi-drug resistant tuberculosis, or extensively drug-resistant tuberculosis. There are 17 segregation units in all. The units divide patients according to their TB status and level of infectiousness. Patients only leave their assigned unit for medical reasons or for family visits. But even here, they're segregated.
Meeting their families is very important. This is key to their reintegration back into society. They have to be in contact with their families in order not to be isolated from society. And so they have the right to meet with their families.
After they have completed their treatment, patients are kept under strict observation. They stay inside the institute for a further 3 to 6 months, so that the staff can monitor any changes to their immune system, treat any ongoing side effects, and check that they're cured before sending them back to prison to complete their sentence.
Our main aim is to ensure that they're completely cured before we send them back to prison. Like this, they don't keep on coming back here, and they're also not a health risk to the other prisoners.
One of the biggest challenges in combating TB is managing the release of patients who've completed their sentence but not their treatment. A few years ago, there was no follow-up supervision of the 120 or so TB patients released each year. But today, a non-governmental organization supported by the Ministry of Justice provides information on social and medical services and supervises ongoing treatment.
We are doing social support to the patient to continue their treatment after release. So treatment, we try to ensure treatment adherence among released TB patients. So they take full course of treatment and get recovered of the disease.
The organization supplies clinics with second-line MDR TB drugs. It provides ex-detainees with extra food and covers their transport charges. Sayed Kamil has been in and out of prison for most of his adult life. He was treated for TB in prison in 2009, but now has MDR TB, which has left him with serious side effects.
After taking the MDR TB drugs, I started having problems with my hearing. Now I don't hear words well at all. I never thought about refusing treatment. Right from the beginning, I knew that I wanted to finish it and be cured.
Under this guided supervision program, most ex-detainees now complete their treatment. It's an important contribution to fighting the spread of TB in the wider community. This integrated approach to treating detainees with TB has achieved remarkable results. At the Special Treatment Institute, mortality rates have decreased year on year from 45% in 1995 to 3.4% in 2011.
We love our jobs. When we see our achievements and the outcomes of our work, we're all very proud. We are, of course, aware that every breath we take here could be fatal. But despite all of this, all of the team and staff members really love what they do.
On a recent visit, representatives from the Global Fund and the World Health Organization were impressed by the approach.
In terms of treatment success rate, they have very good system because they discuss with the patients, they talk with them, they have very good approach to the patient, humanitarian approach, I would say, that they see patients as a human being that they need to be treated. Certainly as a strong model can be an example for other countries. We certainly highly recommend that one, and hopefully also other member states can come here from the other prison sector to come and visit.
The success of the Special Treatment Institute is due to many factors. The high level of political commitment from the Azerbaijani authorities to lowering TB morbidity and mortality rates in places of detention. The direct line between the Minister of Justice and the Minister of Health, or the Health Department within the Ministry of Justice. This ensures, in turn, the patients receive the individual attention and specialized treatment they require. It also facilitates follow-up care on release through community-based partners. Azerbaijan is an outstanding example in the region of how to combat MDR TB in detention. With the disease on the rise, authorities need to remain constantly vigilant, never letting down their guard if they're to keep the disease under control.